Welcome to Truth Seekers, a podcast that challenges the false corporate narrative underlying social injustice and the erosion of democracy. Today we hear former health insurance executive and whistleblower Wendell Potter deconstructing language of the powerful medical industrial lobby. Wendell Potter left a 20-year career as an executive with the insurance industry in 2008 after a crisis of conscience. He cited an industry that flouts regulations and skews the political debate with multi-million-dollar PR campaigns to mislead the press and the public, and to preempt the needs of the sick and dying to preserve industry's huge profit margins. Subsequently, he wrote, "Deadly Spin, an insurance insider speaks out on how corporate PR is killing healthcare and deceiving Americans." Potter is now speaking up about the industry coalition comprised of insurance, pharma, hospital, AMA, and others who profit mightily from today's medical industrial complex. This coalition of the entitled has formed a front group called the Partnership for America's Healthcare Future for the purpose of spinning the issue of healthcare reform in order to oppose Medicare for all and to protect their bottom line profits. Notes Potter, a tremendous amount of U.S. healthcare spending goes to bankrolling industry's propaganda machine and lobbyist efforts to protect industry profits. Following, Potter cites some of the industry's manufactured lies. First, industry asserts that nearly 180 million Americans have accessible, quality, employer-provided coverage.
Today, nearly 180 million Americans with employer-provided coverage have access to affordable, quality health care.
Not quite, says Potter.
It's true that 180 million Americans get health insurance from their employer, just under half the country. But employee contributions to their plans have gone up an average of 21% over the past 5 years, far outstripping average wage growth. So I wouldn't call it affordable. Secondly, it's not clear that the quality is so great. If we look at comparable wealthy countries, we have a lower life expectancy, higher rates of infant mortality, the highest rates of hospitalization for preventable diseases, and the highest rates of preventable death from medical conditions.
Industry asserts that most people get their care from employer-sponsored plans. False, says Potter.
This is a little thing, but 49% is not most people.
Industry asserts some people are proposing we start over and eliminate employer-provided insurance. In truth, employer-provided insurance is becoming more costly to employees, who are required to pay more every year and end up with fewer benefits at higher costs. This is Wendell Potter's response.
Technically, we're proposing we eliminate all commercial insurance, but I like where this is going.
Whether it's called Medicare for all,
Great.
single payer,
Now you're getting it.
or a public option,
2 out of 3 ain't bad, but pretending that the public option is the same as Medicare for all is a particularly devious lie. A public option would leave the commercial insurance industry in place and let them cherry pick the most profitable patients while putting less healthy, higher risk patients onto government programs. It'd be an improvement over what we have now, but wouldn't get us the needed cost savings built into single payer.
One of industry's favorite talking points is that Medicare for all is one size fits all and cannot possibly provide choices to people. In fact, Medicare for all provides choice where it counts. That is, full choice of providers, rather than choice of multiple fragmented health plans that each limit choice with a limited network of providers.
a one-size-fits-all healthcare system will mean all Americans have less choice and control over their doctors, treatments, and coverage.
This is just a bald-faced lie. Right now, if you have the luxury to be able to afford a visit to the doctor, you can only go to physicians that are in-network and receive treatments that your insurance company approves. Under Medicare for All, you'd have the ability to go to any doctor or medical provider of your choosing, and we'd eliminate the profit incentive that insurance companies have to deny treatment.
Industry then asserts that Medicare for All would increase costs to families, reduce quality of care, and increase wait times for care.
It will also mean trillions in higher taxes for hardworking families, lower quality of care, and longer wait times for patients.
We already covered how our quality of care is actually much worse than what patients receive in single-payer countries. But let's cover the tax issue. It's true that there would be some new taxes for businesses and individuals to fund this Medicare for All system. However, they conveniently ignore the fact that a single-payer system would save us trillions of dollars over the next decade, and that as a result, the vast majority of workers and employers would be paying significantly less than they currently pay in premiums and out-of-pocket costs. Finally, we get to the industry's favorite talking point, wait times. There's no evidence that Medicare for All would lead to longer wait times for patients, but the reality is that currently, very few people in the U.S. receive the preventative care and screenings they need, and they ignore the fact that Americans wait longer than people anywhere else in the developed world to see a doctor for needed medical care due to cost, including people with private insurance with such high deductibles they can't afford to actually use it.
As Potter states, currently there are many people who cannot afford to use their insurance due to high out-of-pocket costs, premiums, co-pays, and deductibles, which would be mostly eliminated with Medicare for All.
And healthcare decisions would be shifted from patients and their doctors to politicians and bureaucrats.
Right now, when your doctor decides that you need medical attention, you have to hope that your insurance company will decide to pay for it. Since the insurance company's only responsibility is to their shareholders, they will look for any way they can to ignore your doctor and deny the claim. If we take the profit motive away from healthcare financing, doctors will be able to provide the treatment they know you need, and you won't have to worry about drowning in medical debt. Seems like a no-brainer.
Potter responds to the reality that insurance companies practice what has long been called denial management. That is, they frequently deny healthcare claims in order to inflate their bottom line. This practice results in higher administrative costs for physicians, who are required to resubmit claims for treatment a number of times to insurance companies.
America could work to improve what's working.
It is absolutely not working. It's the most expensive system in the world. Nearly 28 million people are uninsured, and we have worse healthcare results.
In short, commercial health insurers are draining healthcare dollars from the system to increase their profits, including ever higher subsidies to privatized insurance, including Medicare Advantage plans. Administrative costs are exponentially increased by multiple fragmented, inefficient, small risk pool insurance plans. Dozens of studies over several decades have demonstrated that the most sustainable universal coverage is possible with a national public health insurance, also known as single payer or Medicare for All, consisting of a single large risk pool, replacing inefficient, numerous small risk pool insurers that are actuarially unsound and therefore more costly, and that reduce benefits even as they shift higher costs to the insured. No more high out-of-pocket expenses, premiums, co-pays, or deductibles with Medicare for All. Everybody gets health care when he or she needs it. Thank you for joining Truth Seekers, advocating for the most sustainable universal health insurance model, a single large risk pool Medicare for All health insurance. Until next time, everybody in the pool. Truth Seekers, produced at Denver Open Media. Music by Tim Johnson. Underwriting by Healthcare for All Colorado Foundation. Today, featuring Dismantling Lies of the Insurance Industry, recorded by Wendell Potter with the Business Initiative for Health Policy.